Hi, I'm Kate from East Park Dental, and this is my assistant Zoe.
Hello.
And we thought it would be really nice to share with you some top tips on how to keep your mouth healthy at home. Right, first up we are going to talk
Toothbrushing.
If you're using a manual toothbrush, you want to go for something with a nice small head, nothing fancy. Medium textured bristles are always best. And the best technique is to hold the toothbrush at a 45-degree angle, cupping the tooth and taking the bristles along the gum margin. And you almost want to be taking those toothbrush bristles slightly underneath the gum. You use a nice small circular motion, or you can go backwards and forwards, but the most important thing is to not move the toothbrush too quickly or too hard. If we're over scrubbing our teeth and our gums, we can cause damage, we can cause gum recession, and we can cause damage to the tooth surface. So nice, very small little motions getting into those all important gaps and crevices. And don't forget, you need to brush all of the surfaces on the outside, top and bottom, all of the surfaces on the inside, top and bottom. And then I always end up by doing the biting surfaces. This is where we chew our food, and this is where we can give them a bit more of a scrub. So how many times a day should we be brushing our teeth, Zoe?
2.
And what's the most important time to brush your teeth?
Night time.
At night time, because our saliva flow reduces at night time and our teeth aren't as well protected. And of course, we've been eating food all day long, so it's important to get the food and the plaque off. Now, quite a lot of our patients are using an electric toothbrush, and it's a very similar technique. You're cupping the tooth in at an angle, bristles towards the gum line, ever so slightly underneath, but don't push hard. And with an electric toothbrush, it does the movement for you. So it's quite important to hold the toothbrush still on one tooth at a time. It's quite noisy. So cupping the tooth up to the gum line and giving it a slight little wriggle. And then the next tooth, up and in. And up and in. And if you push too hard, you can see there's a red light that comes on. So you mustn't push too hard. Right, next up, we're going to talk a little bit about
fluoride toothpaste.
Now, it's really important to use fluoride toothpaste on your teeth twice a day. This will help to protect your teeth against tooth decay and developing cavities. It also helps to keep your breath fresh and your teeth nice and clean. Now, this is the amount that we usually recommend. We call it a pea-sized amount. And we always recommend our patients, especially in the evening, to what we call spit, don't rinse. And this involves spitting out the excess toothpaste in your mouth once you've finished brushing, but try to refrain from washing your mouth with water afterwards. Don't go to bed foaming at the mouth, but you don't want to rinse your mouth with water afterwards. And if you're using a sensitive toothpaste, if you've got sensitive teeth, this little trick at night time, if you're not washing it off with water, this is going to make your sensitive toothpaste work much harder. Last of all, we must talk about
cleaning in between your teeth.
Now, this is really important because toothbrushing alone won't penetrate all the way in between our teeth. It's really important that we clean in between our teeth regularly to remove the buildup of plaque that could possibly cause tooth decay and gum disease. Now, we have various different gadgets to help clean in between our teeth. Floss, or this is tape, I like tape. Or we have little flossing gadgets or flossettes, and we have interdental brushes or interdental picks. I'm going to show you the flossing technique first. I will show you with my little flossing gadget because it's easier for you guys to see. If you are using floss out of a packet like this, just always give yourself a really nice long piece and wrap it around your second fingernails. This is what I do. And then you've got your first finger and thumb to grab hold of the floss, okay? This is the same technique whether you're using floss like this or floss that's on a little holder. So we generally need to start off by sawing very gently in between the teeth to get it in between and past that contact point. Once we're in, we push the floss flush to one of the side of the teeth and we go down to the bottom and underneath the gum crevice. At this point, we then manoeuvre the floss up and down in a scooping motion, I always think this is scooping the plaque from underneath that gum crevice. And then we move the floss over to the other side, flush to the other tooth, take it down underneath that gum crevice and up and down, up and down, up and down. Think of it as a scooping motion, and then out at the top. If you're using normal floss and it's a bit tight to get it in, you can always let go and pull it through. Now, quite a lot of our patients are using these interdental brushes. I think it's really handy to use the cap, pop it on the bottom, and it turns it into a handle, makes it so much easier to get to the back teeth, and also bend the brush over slightly at a right angle. The best way to use the interdental brushes, you must use the right size, and then you're wiggling the brush across the gap at 90 degrees, and then you're manoeuvring the brush parallel in and out a few times. Now, usually we have shown you the best size to use when you come for your appointments. This is so important. If you're using a brush that's too small, it's not going to clean effectively. And obviously if you're trying to force a brush in that's too big, then you're going to end up hurting yourself. Now, it can be tricky cleaning in between your teeth. If you can do it daily, that is fantastic. However, if you can do it about 3 times a week, I think you're winning. Do your best. Thank you for listening to our top tips. I hope you found this helpful. Take good care of yourselves and
Stay safe.